Moving on, the session is about strategic management, and the last 10 minutes of the session will be allotted for question and answer round. Strategy is about shaping the future. In every instance or situation that has come to the strategic managers, whether through traditional or non-traditional methods, they are the ones who take an extra step. A structured strategic management approach is what's needed to tackle the revolutionary change the healthcare system has been experiencing. It's our immense pleasure to have Mr. Daljit Singh to enlighten us on this topic. A few minutes back, in the speaker's green room, when I had a word with Sir and asked him as to anything additional to be mentioned about the session, he just said, "Tell everyone, he's a great guy." Indeed, sir, you are. Mr. Daljit Singh currently is the President of Strategy and Organizational Development for Fortis Healthcare Limited and was formerly the Chief Executive Officer of the same organization. Mr. Singh is also the President of Strategy and Organizational Development for Escorts Heart Institute and Research Center, an affiliate of Escorts Heart Center Limited as well as Axo India Nobel Limited. Prior to joining Fortis, he was the Director of Human Resource Communications and Safety, Security, Health and Environment of ICI India Limited for 30 years. He has an extensive experience in the healthcare industry. Also, he is a director at Religare Wellness Limited. Sir holds a BTech degree in Chemical Engineering from the prestigious Indian Institute of Technology, New Delhi. I now request Mr. Daljit Singh to kindly address the audience.
Good afternoon, ladies and gentlemen. I didn't know my beautiful compere would let out the cat, but never mind. I think we have to go with whatever compere says. I did tell her, I said, keep it brief, but do tell them I'm a great guy. So she's kept to her promise. So today's topic before us is to do with strategy in healthcare. And I have addressed a similar audience before, largely on the same theme, but I've tried to reorient my presentation today, keeping in mind that strategy and thoughts around strategy are also evolutionary in nature. So what is it that I intend to cover today? I have laid out the agenda. There are one, and the first two ones I think are very important, first two or three. It's about setting the context. Every strategy happens within the framework of a concept. It cannot be done in isolation of what the sector is all about and what the challenges and the issues that confront this particular sector are. And from our perspective, there are 5 themes. One is around the healthcare landscape of our country, challenges in the ecosystem, challenges at a more micro level for healthcare providers, people who run hospitals. What exactly are the issues that we actually face? What are the issues that we need to battle on a day-to-day basis? What is it that we need to plan for? Then a quick 2 slides about my organization. And finally, about what really has been our approach towards strategy. It's really a practical and real-life example. So it's not from the theory books. It's about stuff that we've actually tried to implement over the last 12 or 13 years that we've been in existence. So let's look at slide number 1. And this, at a very high level, talks about the healthcare system in our country. And if you look at it, the market of healthcare has risen reasonably well at about almost, and there are different statistics depending on what you take. People talk about it growing from about 14% CAGR to about 18% CAGR. I've taken a figure of 18% here. In terms of inequity, I think I was just talking to somebody over lunch that ours is a very unique issue in our country, that people who are probably gathered here who live in big cities, we are very fortunate. We have access to some of the best world-class facilities, comparable to almost anything available in the world, where the intensity of hospitals, intensity of doctors and super specialists is available at the end of a telephone. However, you step 20, 30 kilometers outside Pune or Delhi or Bombay, and you really fall off a cliff because there's little or no healthcare available to people who actually live in rural areas or in very small towns. I feel like a spaceman. I'm not sure whether I look like one at least. So many things have been strapped around. So I think this inequity in healthcare is a very, very major issue. And if you look at the slide at the right-hand corner, it simply tells you that if this was the position of beds in our country, about 2.5 beds in a place like Delhi, in urban areas, in the rural and small town areas, only 0.2. Number of beds available to patients. And recognize in rural areas, small towns, accommodate something like 60 to 70% of our entire population. And the same thing, even if you look at how we've grown over the last 10 years, the inequity continues. And that's a very major cause of concern for all of us. At the bottom, it gives you the entire healthcare market, which really means it talks about pharma, diagnostics, medical equipment, medical insurance, etc. And only this green part is healthcare delivery, which is to do with hospitals, nursing homes, doctors, clinics. And when we come to this particular slide, what it really says is that we spend only about 4% of our entire GDP on healthcare delivery, which by any standards is a very, very low figure. Out of that 4%, 1 percentage point, or 1/4 of it is spent by the government, and the balance is actually private expenditure, which really means that bulk of the people who go to hospitals pay out of pocket for the healthcare, which is a trend which is extremely different compared to the developed world. We don't necessarily need to copy everything that's happening in the developed world, because the developed world has also gone wrong horribly, especially the US, where they spend about 17 or 18% of their GDP on healthcare, and it's probably one of the reasons why America is going to go through a major traumatic time over the next few years. In terms of delivery structure in our own country, if you look at it this way, and this is what I was saying, if you look at the top part, and the rural part, which comprises 65–70% of our population, has access to only 15% of healthcare resources, which is a major, major inequity. Also, healthcare in the smaller towns and rural areas is largely unregulated. So we don't know whether it's quality healthcare or not. So it's a luck of the draw. Sometimes good things are happening, and sometimes probably inappropriate levels of treatment take place. If you look at some quick facts here, although we are 17% of the world population, 20% of the world's disease burden, our diseases and infrastructure have a regional skew. So in different parts of India, India is like a mini continent, and there are different intensity of infrastructure and diseases when you look at different parts of the country. And the other part is that till recently we thought that non-communicable diseases like cardiovascular diseases or cancers and neurosurgical disorders, neurodisorders, that they were only within the purview of people like us who are more affluent. But what we found is that NCDs are now pervasive also in the population which is not well-to-do. So diabetes, cardiovascular diseases, neurodisorders are pretty common and it's a double whammy, because we have infectious disease at one end, basic primary health issues at one end, and lifestyle disease at the other end, and we need to tackle all of it. And if we don't do it well, we are in a jam. And really, if you look at this part of the pie, what it really says is that lifestyle diseases are now increasing, whereas in 1990, the blue part represented infectious diseases. Today, as we stand here, a larger part of the pie is to do with lifestyle diseases for our country. So what are the challenges that the healthcare ecosystem today faces? What are the issues in front of the larger system across the country? This is a very busy slide, but what effectively tells you is that if the healthcare ecosystem is there in the center, it has to contend with 4 major issues. One part is to do with regulatory issues, okay? So there are and the regulatory part are to do with there's a lot of business that happens in our country which is regulated by the government, and where hospitals or providers provide contracted services to CGHS, ECHS, and many other governmental bodies and state government employees. There are huge issues from a healthcare ecosystem point of view that the prices that are actually offered to healthcare providers are extremely low. In fact, over the last 15 years, the CGHS prices of delivery in healthcare have actually gone down, and many hospitals today have stopped doing CGHS work. And that's a shame because very large populations are actually covered there. There are issues around payments and late payments and outstanding dues. There are also significant medical legal issues which are beginning to now come up in our country, which hospital providers need to contend with and need to provide for. Competition across segments. We are seeing new entrants coming in, new delivery models are coming in, and there is a commoditization of high-end stuff which is happening. And therefore, as the sector is beginning to develop and mature, we have to contend with new models which come in, and that this happens in any sector, and this is a reality that healthcare too is actually facing. On the third front is rising input costs, and this we'll talk about a little later as well, but in every aspect, be it in terms of variable costs are costs which are incurred on drugs and consumables. These have gone up quite dramatically. The manpower costs over the last 10 to 12 years that I've been in the healthcare sector have again gone up dramatically, and I'll talk about some pretty astounding statistics there, much higher than inflation and certainly much higher compared to the rate at which prices in healthcare have gone up. Our capital expenditures have gone up by about 3 times in the last 10 to 12 years. And against this part of it, we do need to still create a model which is financially sustainable, because private healthcare is about the ability to stand on your own feet and be able to generate surplus in order to invest in the future. Affordability and accessibility, these are big issues in our country. Large part of our countrymen cannot afford healthcare, and therefore they don't have the means to pay for healthcare, and therefore government is coming up with large social insurance schemes to allow people to come in there. So RSBY, etc., some of those schemes which are there. And accessibility, which really means that bulk of the people need to travel long distances to access healthcare facilities. Again, in terms of beds per 1,000, this simply tells you that India, when compared to the rest of the world, is abysmally low in terms of its infrastructure. We are about the lowest in the world. Recommended is about 3 beds per 1,000 people. We are at a level of about 1.3 beds. So we are not even halfway, where we need to be. Affordability, 16% of the population is covered under health insurance only. Pocket, and healthcare is a major cause for rural indebtedness. And you've heard about farmer suicides, etc., that actually takes place. In terms of quality, this is again a very major issue in our country. At a very high level, if you look at accreditation, which defines quality in one dimension, NABH are our national standards for hospital organizations. Out of an estimated about 60,000 nursing homes and hospitals in our country, just over 150 are NABH accredited today, which really means that bulk of our system is not self-regulating. It's a major issue for us. Inadequate monitoring, although we have rules and regulations, these cannot be implemented for want of monitoring. There are very few good quality educational institutions, so when either doctors or nurses, etc., are produced, they're not necessarily of a good caliber, and they need to be retrained, and a lot of investment needs to be made to healthcare delivery. And there's a significant mismatch, as we see, between the type of talent that is produced by majority of our medical institutions and what we actually need to deliver performance and care at the hospital level. And those are issues that we need to do. The slide at the bottom simply tells us, in some ways, between high-income countries, upper middle-income countries, and low-medium-income countries. In terms of the technology deployment, so MRIs and CT scans that are actually deployed, in terms of certain ratios, are about very, very low in India. We are only at about that level out there compared to middle-income countries and compared to developed countries. So there's a huge gap for us to fill and for it to meet the needs of our large population. Foundation of India's healthcare system is inadequate and poorly served, which is really primary care. As I was mentioning to somebody over lunch today, our biggest problem is that the foundation is very weak for the bulk of our population. We don't have clean water, we don't have sanitation, we are not able to take care of our very, very high maternal mortality rates or infant mortality rates. These are indicators that the foundations are, at one end, our foundations are very weak. At the other end, at high-end facilities, we also are able to deliver world-class care. It's a big dichotomy that we actually live with today, and we need to sort that out. So challenges for healthcare delivery firms like Fortis, like Apollo, like Max, or actually runs healthcare delivery. What are these? One part that, I'm simply giving you a flavor from my experience, and I've been in healthcare since 2002, basically, so I've been around for almost 12 years. When I joined the company in 2002 in our Mohali hospital, we used to charge a certain amount for a cardiac surgery or for a knee replacement. If you look at our 40% more than what they existed 12 years ago, okay? In relation to that, my other costs have gone up quite dramatically. And this really is talking about the shift in prices of key procedures. So blue corresponds to blue, the yellow corresponds to yellow, this corresponds to this. And if you look at a very average, some of the major procedures, this is the sort of price increases that we've had over 12 years of hospital operations. Now, in most of the things, we've seen prices actually go up. But in reality, in healthcare, this is what we faced. In relation to this, what has really happened? Our consumable costs, so if you look at drugs and consumables have gone up by about 95%. Drugs costs have actually gone up by about 75%. Implants, 60%. Our operating expenditures in general administration, about 155% they've actually gone up by. Power has gone up by 130%. Rentals by over 125%. You look at manpower costs, and this is actually the biggest millstone that we need to battle against. And we've done some sums, and we've looked at some of the large players, and this is the way costs have actually risen over a period of time. If you just look at people in the non-medical domain, so a person like me, I'm in the non-medical domain, or we have executives who actually work, costs have gone up by about a differential, almost 3 times they've actually gone up to 15.1. In terms of nurses, our costs have again gone up by about 200%. If you look at our residents, 13 to 53, 4-fold increase. If you look at our technicians, they've gone up by, again, 3 times. And if you look at unskilled, semi-skilled, and skilled people, the figures, I won't even go into that detail. And this is the level of manpower cost inflation that we need to deal with when running a hospital organization. I know many people get a sense that when you come to big hospitals which have quality systems, they charge too much. But the fact of the matter is that the costs are also very, very high. There's a huge amount of cost to pay for a great infrastructure, great technology, high-end doctors, and high-end equipment and systems that are there. And this is what actually, in many ways, drives the costs of healthcare delivery. And we need to work against these so-called conflicting requirements. On one side, the prices are contained. On the other side, our costs have gone up quite dramatically and disproportionately so. So how do we make 2 ends meet, and how do we make a sustainable proposition? And that really is the theme of my presentation today. So if you look at project costs, when we built hospitals, our overall costs have gone up by, on a like-to-like basis, by roughly 250%. So if I spent, on a project 100 crores in the year 2002, today I'll be spending closer to 300 crores on the same project, or the same, because cement, every input into building a hospital, many of you built your own houses, you probably will understand what I'm talking about. And the pure cost, capital cost of putting up infrastructure has gone up quite dramatically. Apart from that, if you look at medical equipment constitutes roughly about 20 to 30% of the capital that we actually spend in setting up a hospital. And these costs have gone up quite dramatically. Because, why is that so? Because there's very high obsolescence. High-end technology comes in. So when we started in 2002, we used to tom-tom to the rest of the world that we have India's first 2-slice CT scan. Today, we've got a CT scan which is 500 slice plus available, all in a period of 12 years. And the cost differentials are quite dramatic. And when you pay for that, we have to find a mechanism of creating a return which allows us to afford the luxury of owning equipment is no longer available to the system. So these are very significant issues that we actually need to deal with. So as a result, what is really happening here is that there's a double whammy. There are input costs are going up quite dramatically, and there is limited leeway on price increase. So price increases are determined by the market, by all of you, by people who actually go into hospitals. So the tendency in India is very clearly that when we actually go there, and for right reasons, we shop. So if I want a cardiac surgery, I'll go to a Fortis hospital, and if I don't have that much of money, and money is a significant constraint, which it is for most people, I would go and shop and find out which hospital gives me at a lower cost. And in some ways, quality may go out of the window, standards may go out of the window, but then that's all that I can afford. And that forces us as healthcare providers to maintain our pricing in check. And that's a very, very real issue that we face. So what do hospitals need to do? So hospitals have, the only tool actually that they have in their hands and that they actually work on is in terms of driving productivity and efficiency. And those are different elements. So we figure out a way of enhancing a revenue, that how can we get more patients to come into the hospital? How do we create patient trust? How do we get them service offerings which will make us the preferred supplier of services? How do we improve our gross margins? Gross margins are that after you spend drugs and consumables, the money that you have left is called gross margins. So how do we generate that? How do we manage the costs? How do we manage the inefficiencies in our process of delivery? There are hundreds of interactions that actually happen in a hospital. And how do we make sure that each one of those interactions is optimal and at a least cost? How do we purchase materials at perhaps the most efficient rates? How do we use economies of scale to drive costs down from our suppliers? And how do we optimize our capital expenditure? How do we shorten the times of project execution, and how do we reduce cost per square foot? Well, that's a conundrum that we need to tackle on a day-to-day basis. And therefore, from here now I come to my own organization. So what is it that we started off with? Dr. President Singh, some of you may have known of him. He used to be our chairman of Ranbaxy. He never actually saw any of our hospitals started up. Unfortunately, he succumbed to cancer in 1999, but laid the foundations of Fortis Healthcare before that. And our first hospital was under construction when he passed away. And his basic purpose of setting up healthcare was to provide, this was the purpose statement for setting up Fortis. So what have we done over the last 11, 12 years? What is the vision that has actually guided us? So there must be a guiding principle for everything that anybody does. So Symbiosis has a vision, Fortis also has a vision. And our vision is to be a globally respected healthcare delivery organization known for clinical excellence and distinctive patient care. So there are three elements that are in red here, globally respected. That means you need to do the right things for you to be a respected provider of care. Right thing from a patient perspective, and also right from all your stakeholders' perspective. Clinical excellence is all about ability to do comprehensive clinical work as well as deliver excellent outcomes, because outcomes is what people come to you for. They come to get cured, not to be treated. Distinctive patient care. In our country, we have not necessarily been very sensitive to patient care. So a patient comes to a hospital and has to wait for a doctor for 1 hour or 2 hours. Sometimes he doesn't bother because he knows it's not easy to get to see a doctor. But we don't think that that's a great idea. So we need to look after the patient comfort, the patient experience, once he or she actually enters the hospital. And therefore, what is it that we can do as a hospital system to make sure that our delivery of care is up to a high standard? And this is all achieved through these 4 pillars about people, strong value system, efficient systems, and responsibility towards stakeholders. Unfortunately, the healthcare ecosystem has a lousy image nationally, and perhaps for good reasons. There are some very unethical practices that actually operate in the system, and therefore, once that happens, especially in healthcare delivery, it doesn't do good to everybody. Everybody else gets smeared. That is, that exists. And this is something which actually bothers us immensely, and we need to work on this as as healthcare drivers. Operational beds with a total capacity of 10,000 possible beds. And so we are a reasonably large organization, and large organizations have their own unique challenges, and I shall talk about them going forward. So what is it, how did we approach strategy in our organization? I think the important part here is that this is a very interesting saying, that to succeed in the future, we have to disturb the present. What brought us here will never get us into the future. So we always need to be looking ahead as to what are the trends shaping the world around us which could actually destabilize our business model. Nothing is there forever, and we've seen many organizations actually disappear from the landscape because they did not see the future fold in. So in the way that we address strategy, effectively, there are several ways of approaching it, but this is one construct. When we worked with McKinsey, this is how we approached it, that where to compete, which are the geographies you actually want to set up your facilities, your businesses in. That's a very, very important question. What is your rationale for the selection of cities or states or towns where you wish to operate? Where do you want to set up your first hospital, and how do you want to expand? Okay? So there must be a rational, compelling rationale which allows you to succeed maximum by making the choices that you do. And the second part is all about how do you compete. And in how do you compete, you need to decide whether you want a deep presence or you want a low-intensity presence. So you want one hospital in New Delhi, one in Bombay, one in Calcutta, one in Chennai, and one Bangalore, and then say you have national presence, or you want multiple hospitals and all this. So if you have multiple hospitals, then you're engaging with the community in a very intense manner in those places. You look at growth. How are you going to grow? You're going to grow organically or inorganically. Organic growth, you can grow perhaps at 20, 25% per annum, but inorganic allows you to occupy market space at a much, much faster pace, which will mean acquisitions, which will mean management contracts, which will mean having joint ventures and partners, and learning how to make these partnerships succeed. What are the size of hospitals you want to operate? You want to run a 50-bed, 30-bed, 100-bed, 150, 200? How do you determine that? What are the choices that you make there? Super specialty versus secondary versus primary. Where does your primary, do you want to be an answer to everything, or do you want to focus and develop a specialization? The world today is becoming increasingly specialized and is leaving the core and is only managing core activities, and everything else is actually being farmed out. Choice of medical programs. How do you want transplants there, organ transplants? Do you want cardiac surgery? Do you want neurosurgery? What level do you want it at? These are all questions that one needs to answer. Level of medical excellence. How good do you want to be? Do you want to, you aspire to compete with some of the best medical systems in the world? Or you want to be the best in New Delhi? Or you want to be the best in the locality within New Delhi? What exactly is your aspiration? Because that will drive your entire strategy. Quality system standardization. What is your commitment to quality in the long term? Is it only going to be lip service, or do you want to drive a system with some very, very strong values which will hold you in long stead, which will develop trust and credibility for you as an organization, but which also means that you need to invest in it, because all these choices have an implication on resources, on expenditure, on the management time that you're willing to spend. What is your target population of patients? Is your hospital going to be an answer to everybody? Or is it going to be focused largely on middle class? Or is it going to be focused on the high end? You've got to make a choice. Pricing high versus moderate versus low compared to this scenario that we live in. Indian prices compared to international prices are extremely low. Even the prices that we charge are 1/20th to 1/30th compared to the prices in the US, for example. But we may be amongst the highest in our country, along with Apollo, Max, and some of the larger players, which may be outside the affordability reach of many people. So the point is, one has to make a choice, because the implication